Well, you might not even realize the smallest foot problems can turn into long-term issues. And one survey found that more than 75% of people have some kind of issue with their feet. And local podiatrist Dr. Candice Kennedy of Total Foot Care and Wellness Clinic joins us now for National Foot Health Awareness Month. And Dr. Kennedy, what are some common foot issues that people might not realize they have?
Yes, so a lot of foot issues can be the result of trauma or even just moderate exercise on the weekend. And so, for example, ankle sprains are really common. It's usually when the ankle twists, usually on an inversion type motion where it's going to go inward, and that's going to strain your ligaments and tendons and create a lot of pain, sometimes swelling and bruising. So you definitely want to get with your local podiatrist to check that out. Also bunions. Usually you already have a bunion. It's typically something that you inherited from your family, but wearing shoes that don't properly fit, coupled with bad activity, can result in a lot of pain and sometimes surgery. Also diabetics, that's probably our highest at-risk population.
Really?
Yes.
Oh, I didn't even know that.
Yes.
Why is that?
Yes, because a lot of diabetics, they go on to get infections that they may not even be aware of. They tend to have decreased sensation, and so they may step on something sharp, not feel it. It becomes infected, and it can result in amputation. So it's very serious and really important that they see their podiatrist at least every 2 months.
Well, I see you've got some samples here. What is a good shoe that you recommend if someone is having reoccurring foot problems?
Yes, so my favorite is New Balance for a number of reasons. It's the only shoe, aside from a custom-made shoe, that has extra width from side to side in the toe box area, also extra depth from top to bottom, and it only bends at the foot instead of bending here at the midfoot, so therefore you're going to get a lot more stability and support for your foot. And because it has a lot of space, you can also nicely put an insert, whether it be an over-the-counter insert or a custom insert.
Okay, and I see some inserts here. What is the difference between these two inserts?
Yes, so this is a non-heat molded diabetic insert, and so when the patient's coming in with diabetic issues, we basically heat mold this to their foot safely. And you can see it has a special top cover called Plastizote, which helps to offload the foot, act as a shock absorber, and also reduce the risk of calluses and ulcers. This one is a custom molded insert where we've actually taken a mold of a patient's foot that's non-diabetic, and it just takes into account every nook and cranny and just kind of realigns the foot and gives them more support and helps to reduce pain.
All right, well, this is such great information. Real quick before we go, when should people start considering reaching out to a podiatrist?
I feel that every single person that has, a 1 foot or 2 foot should definitely see a podiatrist. At Total Foot Care and Wellness Clinic, we really like to see our patients at least once a month for more serious issues. If it's something that's more stable, maybe we can push it out to about 3 to 6 months so that we can try to prevent issues before they become problematic.
All right, that's definitely important. Make sure you go before it does become a problem. Thank you so much, Dr. Kennedy, for joining us this morning.
Thank you for having me.